here with FFA for, thank you, Erica. I'm glad you did that because I was about to remind you. Um, so I've been working with FFA for a little over a year. Previous to that, I actually worked for one of the managed care companies that serves Medicaid and for 10 years. But previous to that, I always worked with foster care and adoptions. So just to give you a little history of me, I've got a little bit of everything in the background. Um, what we're gonna cover today, and Erica, you can go to the next slide. We're gonna cover several things. I'm gonna level set and kind of cover where recognizing warning signs of mental health issues. You guys are maybe beyond that, but just not knowing, I wanted to go ahead and add this in and talk about practical steps in taking actions to document and connect to the appropriate supports, navigating Medicaid services, which is, it's a challenge in North Carolina. We have a lot of plans. So we'll talk a little bit about that. We'll talk quite a bit about that. And your role as a caregiver, how you can strengthen the treatment outcomes for your kids. So that's our plan. So next slide. So goal, and Erica laid out the ground rules really, but we want you to feel confident in spotting concerns and connecting to help for your kids. And for you guys, I mean, it's just, we talked about confidentiality in terms of what's happening. This is going to be recorded. But also take care of yourself, step away if you need to. And you guys are your own experts. And we know that. So you're the expert in your experience for sure. All right, next slide, Erica. Thank you. All right. Whoop, didn't go yet. There we go. So this is just a little exercise, and you can throw, if you want to throw something into the Q&A just to answer this if you'd like, feel free. Um, what does mental wellness mean to you? And for me, just an example, recently, um, I'm reminded of the Buddhist monks which made their way to DC today on day 108. And I did actually get to see them come through. And, it just reminded me that about mindfulness, listening to some of their experiences. And mental wellness to me means being connected, fully present, mindful. And for me, I do meditate and I do exercise, and those are my things. So if you want to share, feel free to throw it in the Q&A. But that is definitely how I take care of myself and how I think about my mental wellness and really work at that because things can be stressful and it's a challenge on some days. All right. You can go to the next slide, Erica, and see if anybody has got anything there. Okay, all names. All right. So let's talk about the signs, early warning signs. Behavior is often communicated from whatever youth are feeling. So they're showing their stress and they're showing trauma through the changes in how they act. So you've got to pay attention to those patterns, and it happens over time. We all have a bad day, and that it doesn't necessarily mean we have a huge issue. But understanding the signs to look for and to watch and see if you see patterns over time. So there's emotional signs, and I kind of laugh at my grandson. We call them big feelings, but big mood swings or irritability. So you kind of have a reaction that's way out of proportion to what happened. Persistent sadness, excessive worry, anxiety, crying a lot. Some of the behavioral signs. First word there, aggression. I'm just reminded, we'll talk a bit later. Aggression means a lot of different things. It can be verbal, it can be physical, it can be posturing. So But those aggression is a bucket really is one of those behavioral signs. Shutting down risky behavior, just breaking rules a lot more than what was your baseline information. And then physical daily life, changes in sleep, appetite, decline in school performance. You see that a lot. Loss of interest in activities. Sometimes it's hygiene. So just those are early warning signs you want to pay attention to. All right, next slide. All right, so now there's safety red flags. So there's a few things that immediate action needs to happen. If someone is talking about wanting to die or I want to kill myself, that's a place where you want to really pay attention and take some immediate action. Making threats to harm others, saying I'm going to kill you. Um, I'm giving away possessions or writing goodbye notes, looking for weapons, ways to hurt themselves, searching for knives, razors, those kinds of things. So the 988 is the easiest crisis line to remember, and it does connect in North Carolina to services locally. So I really suggest that has been a big initiative for our state to follow along with the federal rules on 988, and we really have done a pretty good job at that as a state. So I would strongly suggest using that. I threw in Healthy Blue Care Together member services line, and we can talk about that more too. But their member services line operates 24/7 and it does guide for where you can go to get help during a more immediate crisis. All right, next line. All right, so kids in no surprise, you guys know this. Trauma and foster care kind of go together. Kids in care because they've been removed. There's always, some loss there when kids are removed from home. But kids in care often show their stress through behavior. And this can look like defiance. It can look like withdrawal, shutdown. But underneath it is fear, loss, and past hurt. So for you guys, you don't have to diagnose, but your role is to notice it and speak up early. So next slide. So here's a little activity you can do around, and if you think about a stressful situation, think of a time your child went through a stressful situation. Maybe it's a move, maybe it's school, maybe it's peer changes, and you think about that, and then think about what behaviors led you to know that it was a stressful situation. Now, sometimes, like with a move, you can anticipate that that's going to be stressful at some level. But what did you notice? What were the behaviors? And feel free to add them into the Q&A if you want. And then if you can discuss with a partner, a spouse, someone else who works with your child, you can start validating those observations and validating what you're noticing, because maybe it's more than one person that works with your child notices it. All right. Go ahead to the next slide, Erica. All right. So steps to secure support. And we're going to start talking about Medicaid here in just a second. So once you notice the changes, here's what you want to do. You really want to document what you're seeing and be as specific and concrete as you can. What happens? Paint a picture for somebody else. If you're going to go see a therapist and have them assess your child, the more they can visualize and understand what you're seeing, the better they're going to be at diagnosing. So write down what you're seeing, how often, what triggers it if you can figure that out, and concrete examples. Paint a picture. Think if somebody read what I just wrote, could they tell exactly what I just saw? All right. Communicate with your team. You've got a social worker or caseworker. If your child has a therapist, ask for a check-in or an updated assessment. If things have changed with your child significantly, you want an updated assessment. If there's not a therapist involved with your child, secure an appointment with one to get an assessment, and we'll talk about that in a minute. Know when it's urgent, threats of self-harm, we just talked about that. And there are mobile teams that can come to you and you can access them through 988. And they come and they will assess and determine kind of what your next steps may need to be. And follow through. You know, a crisis is a crisis right then. And that's the very definition of crisis. So if you feel like your child is in a crisis, you're not going to wait a day to deal with it. You really want to act more urgently than that. So you need a plan. What is the plan? Who's doing what? And we'll check, when do we check back in as a team? And again, as a team, you're making decisions quickly, particularly if you are handling crisis. So keep some notes of the decisions so you don't lose track. All right, next slide. So create a support map. This is really helpful. It just, the more people you have involved in your world, the harder it is to keep up with everything. I don't need to tell you guys that because I'm sure you're feeling it. So create a support map. List out who the team is. It's your social worker, a therapist or a counselor, a prescriber if your child's on medications, psychiatrist, or it could be a primary care doc, or a psychiatric nurse practitioner or a physician's assistant, school counselor or teacher. And if they're receiving Medicaid services, you're going to have a care manager and the crisis hotline numbers. Have this list ready. It makes it easier to act quickly when your concerns arise. All right, next slide. All right, quick scenario, and I'd love your thoughts in the Q&A. It'll make you work a little bit, guys. So, what would you do? Child suddenly stops going to school and spends all day shut in their room. What are your first couple of steps? What are you thinking? And I've got some ideas there.
And Kate, just a reminder, if anybody wants to raise their hand, I can also unmute them.
Yep. So you guys are gonna do nothing? You know I'm kidding. Ah, talk and listen. Yeah, sure. You want to find out what's going on, right? And talk with your child and ask what's happening, and see if you can figure out. And maybe that will help them figure out what's going on too. If they don't have it right there in their acting out of emotion, they might not understand what's going on and have to sort it out. The other thing in here too, and I threw this in here, but call your caseworker to share concerns and try and see if we have ideas for next steps. That's where your care team is really helpful in helping to identify what next steps might be. But your caseworker probably knows your child and you better than most, and so they can really help sort through that. And of course, if safety is an issue, use crisis resources. And can't stress that enough. If it's really crisis and you're worried about safety, you need to take action. So, all right, next slide. All right, so Medicaid. So North Carolina Medicaid is complicated. I'm assuming that most of you guys that are here are have someone receiving Healthy Blue Care Together. If you're receiving another, if you're with another plan, throw it in the chat so I can address that too. But oh, thank you, Hattie, and see what you were saying too. Um, I appreciate that. Talk to them, possibly talk to the school to see if there are changes. Good one. Good one. So, again, I'm assuming most of you guys are assigned to Healthy Blue Care Together. That rolled out December 1, and that's a statewide plan that is for children and families involved in child welfare. So these are kids in foster care and kids that have been adopted and youth who could be up to 26, those aging out of foster care. So, but North Carolina Medicaid itself covers medically necessary behavioral health services and it covers medically necessary physical health services. However, we're talking about behavioral health. The services range from at the low end outpatient therapy to intensive crisis intervention, and there's a lot of things in between. So let's go to the next step. And if you visualize that stair step, your high end is where it starts, and you want to get down the stairs to recovery. However, that high end is different for whatever the family, the child needs. So let's talk about getting engaged in services. So first of all, there's some commonalities between all the plans, no matter what. Your first entry in is to get a diagnostic assessment. It's also called a comprehensive clinical assessment or a comprehensive trauma-informed clinical assessment. So that assessment is your roadmap in. And what it does is it assigns a diagnosis to your child, which actually also assigns medical necessity for it, at least the therapy services. The licensed clinician assessment is your starting point. It includes, and it could include individual, family, and group therapy. Most have telehealth options for those. Um, and in July of 2026, any child coming into foster care will be receiving a comprehensive trauma-informed assessment. That is something that's new to North Carolina starting in July. There will be a uniform assessment for all kids. Right now, it's not uniform. It's done provider by provider. And so they look slightly different, and the information the providers put in the assessment could be slightly different. And so we really, really want to have a standardized assessment. And I really am excited about that. It's another change, I know, but it really will have better outcomes for our kids. Um, so also next, there's psychiatric services. And again, if they need medication, you've got qualified prescribers. And it doesn't have to be a psychiatrist. It could be a psychiatric nurse practitioner or a PA. They can prescribe in North Carolina under certain conditions. But they definitely are available, and usually the therapist will recommend that. Or you'll hear from school and talk with a care manager and see if that's something they would recommend you getting a consult. Intensive and community-based services, there's if you need more intensive services for your family and your child, there's several options. And I was looking at the Healthy Blue Care Together plan, and they have besides intensive in-home and multi-systemic therapy, there's also some other really good evidence-based intensive in-home services. One's called High Fidelity Wraparound, and usually High Fidelity Wraparound has a family partner and a youth peer partner that are part of the team. And so for older teens, it's always good to have a youth partner. So that is, and there's also family-centered treatment, another evidence-based treatment that has really good outcomes for kids. And so I really suggest that if you need those, look in the Healthy Blue. They have a member service manual, and actually I have a link to it at the end. And there's several different services that could be available if you need intensive community-based services. And again, here's the one thing about Medicaid, and it's like it's an insurance. And so you can't just say, I want intensive community-based services. The assessment must recommend that. So the diagnosis and the symptoms and the assessment must actually match up with the intensity level of intensive community-based services. Crisis stabilization is a little bit different in that Crisis is pretty much you don't need an assessment to get to develop or to use, excuse me, crisis resources. If you call 988, you don't need a therapist to assess previous to calling 988. Now, there may be a recommendation out of that call to get to a therapist. There may be a recommendation to get to a hospital. There could be a recommendation to call mobile crisis. So there are definitely options under crisis that don't require that normal trajectory that I started in the top of the page. So don't let that deter you from calling. And then last but not least, care management coordinate, they're responsible for coordinating care. And so if you don't have a care manager assigned, you will, and you want those services and certainly want more than your outpatient therapy, you really want care management. They know the resources, they have them at their disposal, and it really helps to have them connect all the services across settings, especially if you need multiple services. Okay, next slide.
Hey, just really quick, I just want
Yeah.
to recognize that in the Q&A, we have somebody that is sharing that there have been challenges with utilizing the insurance. And so we just recognize that, yes, there have been different challenges. This plan just started in December, and not everything's working exactly 100%. And so what we would recommend is that you call the member line or talk to your care manager that's been assigned to share your challenges. You can also reach out to FFA via social media and put some information and see if other people are having similar challenges. And there might be a staff member that can share information. There might be another caregiver that can provide information as well. But I do want to recognize that, that is happening, and that people are having some challenges, and it's going to take a second for us to work out all the kinks. And by us, I mean as a stakeholder group community, because Healthy Blue can't do it by themselves. So Kate, I just want to give you a chance too, if there's anything else you wanted to add to that.
Yeah, thanks, Erica. I hadn't been monitoring the Q&A, so I appreciate you pointing that out. Honestly, had this discussion yesterday, and they flipped a switch in one day on December 1st and moved 33,000 people to a brand new plan with brand new staff. And it's statewide, which we've never had. And so it has had some pretty good sized lumps and bumps. And and the staff are not consistent because they don't all understand the same thing across the state. And so I think that yeah, it can keep everyone up to date. That's a great idea. And one of the things that they're doing is they're meeting with Gail and I on a weekly basis. So we're taking feedback. So I'm very happy to get the feedback from you guys. Anything you want to share, we're happy to raise it up. We've been talking with them weekly. Like I said, I meet every Monday at 5 o'clock every Monday. And they know that they've got work to do, and they're looking at it like an onion. Basically, they're starting at the top layer and really working their way down. They're dealing with things like right now, they're dealing with things like the 1915 I waiver. If you don't know what I'm talking about, good for you. But but they're dealing with that. They're dealing with understanding when they need to we're asking them to put out some information just to level set. When do you need to do in-home visits and when do you not? And how do you have that conversation and how do you individualize? And so they're working on some documents that they've got to have approved by the state, but they're going to get some documents that we're going to be able to get out there for you guys on that kind of information. Mainly because care management hasn't been incredibly consistent across the state, and we don't know right now what's the base rules that they're going from. So we're trying to get that out there too as well. But really, please give us feedback. They're listening, they're working to make things better and to level set. They just had a 2-day training for some of the care managers. I actually have been supporting a couple of families in navigating and sat in on a couple of different teams that were actually pretty good. I've seen where some of the problems have been, but I've also seen some of the good stuff going on too. So hopefully we'll get to a much better place here in a few months. It's going to take a while, guys. This is a big, big transition. So
And Kate, just one other thing I want to mention, just because I did get one of these in the Q&A, and there could be somebody else in this situation. So we do provide services to all resource parents, foster, adoptive, kinship, and we do have families in the kinship circle that are both child welfare involved and not child welfare involved. So if you are in that space where you have a young person that is not child welfare involved, they would not be under this plan. So they would continue on
yeah.
the course that they're on. So just making sure we're clear about that.
Yes. And so AmeriHealth is a standard plan. So we'll talk about that. I've got a slide about those as well. Um, all right. Let's go on. There you go. So here's the type of Medicaid managed plans, the managed care plans that are in North Carolina. And all of them have some similarities, but there are some differences. Like we've been talking about, Healthy Blue Care Together is a statewide plan for those involved in child welfare, and it could be children who have been adopted, as well as transitioning from foster care through adulthood. All right, tailored plans. Tailored plans are the plans that have really significant behavioral health needs. Typically, it's going to be a lot of folks with developmental disabilities, intellectual disabilities. And there's a Medicaid waiver program called Innovations that has specific slots. And so you have to have an IDD diagnosis. It has to be pretty functionally significant. So the plans like Via, Alliance, Trillium, Partners, they're the four tailored plans in North Carolina, and they're regionally based and geographically based. Um, Trillium has 47 counties that they cover, mostly eastern North Carolina. Alliance only has six. So it gives you an idea, but they have the most populous counties. So, and they cover pretty high significant needs. There are some similarities between Tailored Plan and Healthy Blue Care Together, except that they're not statewide and they have many less members at this point. And there's no copays for behavioral health services for members under 21 and under 26 if you're in the Healthy Blue Plan. There's no copays required. How to access services. There's a member service line on the back of the Medicaid card. Ask for behavioral services for your child. There's every one of the plans that we were talking about has a member service line. And so if you do a search of your plan, the member services line is definitely your best friend here. It outlines everything that's available. They can help you navigate to find providers. So you can ask your DSF social worker or your caseworker which plan a child is on. DSS deals with enrollment. They don't deal, the individual plans don't deal with enrollment. That is really done through each DSS. So you can always ask your social worker if you don't know or you don't have a card. And again, use the members services or a care manager. And you can use members, if you don't have a care manager, you can use member services to request one. And if services are denied, if there's a specific service that you're seeking to get, and the provider submits an authorization request to do it, and it's denied, you can have appeal rights, meaning you can appeal the decision and you can state why, and they can relook at that decision. There's a federal statute called EPSGT. It's Early Periodic Screening and Diagnostic Treatment is what that stands for. And for children 18 and under, that EPSGT means that you can provide services that are outside the norm if you don't have a similar service in North Carolina's plan. So if you say you were doing intensive in-home and the normal visits were, I don't know, 2 to 3 times a week, but you wanted 7 because your child was really needing intensive services. Now I'm making this up. That's not a real situation, but I'm making it up. That they could perhaps approve more than the 2 to 3 visits. They might not authorize 7, but they could approve more once a physician reviews the request. So under EPSDT, a physician will also always review the appeal and the request. Okay.
Kate, and
Stan,
just really quickly, just because
yeah.
you have the cards up here and somebody asked a question, the
Mhm.
Medicaid cards for children that are in care are sent to DSS, correct? Is that still how that's happening?
Yeah, I
Okay.
think so.
I think that's still because some people are saying they're not receiving cards, and that's kind of happened through the life of foster cares. People don't always receive cards. So I just
Mhm.
think, Kate, that might be something whenever you guys meet on Monday, just saying that's still an issue that people aren't receiving cards. And I would just urge you to ask your social worker
Yeah.
because prior to this plan, that's how most kids, whenever they were in care, that's how the card came through. Now, if your child is adopted and or you've moved to guardianship, then that's different. But if they're in care, that's historically how it's been done. So again, Kate can put that on her list to bring up to Healthy Blue, but also make sure you talk to your social worker.
Yep, definitely. And I will put it on the feedback list that we need to deal with that. One of the challenges I think they were having is the data that when the flip switch happened December 1, the data the state had wasn't entirely accurate. So a lot of cards got lost in that transition, I'm afraid. So, all right, I'll be happy to do that. Um, have you guys been having to figure this out on your own? I see somebody had a care manager, and I think it was Jean said that you got a care manager and it's been good. Um, have you guys had to figure out how to navigate all this on your own? That been a huge challenge? Yeah. I was wondering because I think this has been navigating all these shifts has been tough. Looks like Gene's got his hand up, Erica.
I did. I had my hand up. I was just going to answer the question. Yeah, we were with Mecklenburg County, and it took us until 3 weeks ago to get a card.
Mm,
And they just kept saying they didn't get it. But, the care manager kept saying it was mailed. So I know that problem was not necessarily Healthy Blues issue. But unfortunately, my child, lost services during that time because,
because they weren't assigned to a plan as far as somebody new, right?
right, and no one could give me a number. So that was my great frustration was that, as a foster parent, when I spoke to the care manager, was talking to me and doing all the intake to make a plan for him, but she couldn't provide me with a card.
Yeah. Wow.
So, and that just might be the legalities of it. I just know that the frustration was there was a website. She told me I could go on and get the card, but it wouldn't work. And I'm
Yeah.
fairly tech savvy, so I'm not really sure why it wasn't working or if the system was down. But yeah, that was a frustration. Now that I have that connection, I'm not as frustrated, but it took a while to get my care manager and to get on top of things so that his services could be restarted. And then
Okay.
just the frustration of we're having to get a new provider because our old provider um, does not take that particular insurance.
Uh, and that's really too bad. One of the biggest struggle I think they're having right now is UNC hospitals system is not under contract yet with Healthy Blue. That's still in negotiation. Um, one of the things that the state did put in the plan is they could pay out a network for 6 months. So suppose, so there is a way for UNC to accept it at least while they're negotiating in good faith. Um, Smaller providers sometimes won't do that, and unfortunately, that's where the changes come in. So I don't know the situation with the provider, but the providers are pretty much guaranteed the to be able to do the service for the first 6 months with no authorization,
Okay.
but and get paid. However, some providers just don't want to take the risk.
Yeah.
And
I wish that there had been to all the foster parents some sort of letter from Blue that kind of explained the program and what was being offered, and that 6 months was being offered, so that prior to the change, so that we were better equipped to continue to maintain the level of services that our children are getting.
yeah, I think you're right. There's several points of communication that really failed. I think there were spots of communication. One of them was just what you're talking about right there. Is just understanding the provider landscape enough that you can help navigate the providers, because there's a lot of providers. They had differing understanding. Some had no understanding, and yeah, and it causes transition, which is very frustrating. The other thing that I think was a place that could have been improved is really the information trickling to the social workers on the front line at DSS. Um,
Yes.
that was one of those things that didn't happen real well either. Um, so there's a lot of places where communication fell short, I think. And again, it's easier to look backward, but it is pretty tough to hit everybody. And we kept trying to get information out there, but it really is, it's complicated when
Mm.
it's almost like it's a one-on-one proposition. You had so many different situations, but I do like the idea of having a letter that talks about how you can talk to the provider about the service. I mean, I actually knew the state had it on their website, and I actually cut and pasted it and sent it to people um,
Okay.
as it presented, because of that. People were saying, "Well, I'm not under contract, so I'm not going to get paid." Oh no, you will. Here it is. It's in writing from the state. So anyway, I appreciate that feedback, and we will take it back Monday. They're used to us giving lots of feedback, which is good. It's the way they'll get better, and they have a lot of incentive to do better and to do this well. So I have their medical director I worked with in a previous. She was in a previous role before she took on this job, and have a high degree of respect for her. And she's on that call every Monday and really interested in what people are having to say. And she left a pretty high-powered job to go um, be a foster adoptive parent. So yeah. So I have good deal of respect for her. She's in it for the right reasons, that's for sure. So,
Excellent. Thank you so
yeah.
much. You can mute me again.
Okay. All right. Next one, Erica. All right. So you guys, you know this, but I can't not say it. Your key ingredients to success. And I haven't said a lot about other out-of-home placements, congregate care, PRTFs, that kind of thing. But the reality of those levels of care, even though they're needed for some individual kids, the realities is their percentage of success winds up being about 50% at best. And so you guys actually are key ingredients. You are, even if you have a kid that goes to PRTF or group homes, your involvement actually improves the percentage that are successful at the end. So family, and we used to call it the magic of family, and that really does heal. And so you guys, heal kids by making them feel safe, creating routines that are consistent, predictable. It lowers the anxiety, supports what's happening with therapy. You guys are reinforcing therapeutic skills. I got tickled on I was on a call with a caregiver whose kid was learning how to say yes, okay, and going to do a task instead of arguing. And she was pretty young. And I got tickled because she said, okay, and went and did it. I'll stop and start, praising her. But yeah, I mean, you reinforce those skills and being part of the team, share what you see at home. You have critical information, make it as specific as you can so that others can see what you're seeing. Okay. Next slide. All right. So, yeah, you matter too, big time. Boundaries and self-care. And we're embarking on an initiative to just help with self-care by doing we have a peer coaching program that we'll be rolling out a lot more information about that here in the not too distant future. But part of it is helping folks provide for self-care. You're not a therapist, you don't have to fix everything, but you're there to support, not to replace the therapists, the doctors, but to support them so they can do their job better. But you've got to be able to ask for your own support, respite when you feel overwhelmed, and create yourself a network that is supportive to you so you can take care of yourself. It really does matter. Next slide. All right. What's one action you can take this month? And you guys have already started talking about these things, but you can, take one of these ideas and schedule weekly check-in with your youth. Some of you probably do that daily, but definitely check in how they're doing emotionally. Ask the therapist questions about supporting the skills they're working on. Post-crisis numbers, create your support map of your care team, and then so make a commitment. What's one thing you can do? Just in order to create something different, you're going to have to take a different action. So these are easy things that we can do to help support the treatment as needed. So next slide. So notice early, know your resources, and we're going to talk more about resources in a second. I've got a bunch for you, and you guys are essential. You are the center of treatment. Without you, it wouldn't be happening. So you strengthen those long-term outcomes by creating that safety for the kids. So we appreciate that so much, and we value it so much, and we need our entire system to value that for sure. Next slide, Erica.
Hey, can I just share something really quickly?
Yeah, please.
Just with the notice early, I think that often we hear from foster, adoptive, and kinship families that they're trying to get to know the child, that they don't always want to report everything. They're trying to figure it out, and sometimes people feel like they're a burden. So I would just say, as a previous provider, Kate was a previous provider, that you need to share early and often. That is a true statement. And if your agency is acting like they are not able to receive that information, you need to ask them the best way to share that information. Because if you can start with something small and start addressing it then, that problem could be way more manageable than if we don't report, or somebody's saying that's not an issue right now, and we're kind of just like, okay, and we go months down the road, and then we're like, now what do we do? So I would just encourage you, and again, if somebody's making you feel like that's a burden, I think you need to share that with them and ask for additional supervision and maybe even support from a supervisor so that you can actually share the content of what's relevant and what you're noticing. You guys know these kids best. Even if they've only been in your house for a couple weeks or a couple of months, there might be a social worker they just met that day. And so you know them well and you're seeing everything that's taking place. So I just encourage you to report and share as much as possible.
Absolutely. It used to really worry me when I didn't hear from families because, I would reach out because I think you guys are dealing with a lot of stuff and we just want to be there to partner with you to help you through that and help the kids through that. So, okay, so I've got a lot of stuff for you. So let me walk through this. Some take-home resources. And we're going to post these slides. So DHHS Child Behavioral Health has a couple of things in that available. They're not everywhere in the state, so you want to check. Now I know there is in Mecklenburg County. There is in Wake County. There are in several western counties. There's some in the east, but it doesn't cover every county. It's called Mobile Outreach Response Engagement Services, otherwise known as MORS, because we love acronyms. MORS is a team approach with a qualified professional on the team that's supervised by a licensed clinician, and it has a family peer partner, somebody with lived experience as a family member with someone with mental health challenges. So then they respond in crisis. And like in Mecklenburg County, I know, Jean, you said you guys were in Mecklenburg. I'm thinking there's Spark Services and Carolina Outreach do mobile outreach and response engagement. So there's two organizations that does that. But again, this link will get you there for the crisis services, the Moore's teams. Moore's teams are, I will say, there's a couple of positive things about them if they're available in your area. One is there is a lived partner on the team who understands what it's like to live with a child with behavioral health challenges. That's one thing that they do really well. The second thing is they don't just respond in the crisis, but they can stay involved for up to 8 weeks while you figure out how to stabilize and move into services. So it provides kind of a bridge to other services as needed. So again, it's not available everywhere. The state is working to get it statewide, but they're moving in that direction and cover more counties every year. So I would strongly suggest you look that up. I threw some other training resources. You guys might know all those, but for on-demand or scheduled courses. And I neglected to put creating a family in there, but that's also available through Healthy Blue. And so I've got Healthy Blue Care Together member services. I got your crisis line there. And let's go to the next slide because I imagine a good many of you are Healthy Blue. And so you are going to have some other things that you want to check into. So again, I think they've been focusing on the immediate, getting people in services, fixing some of the glitches like cards and getting big, providers who have not signed on to sign on. So they've been spending their time that way. But they have some things available that they haven't really thrown out there yet in a big way, and I think you will see those. You can ask your care manager if you've been assigned one. If you haven't been assigned one, I strongly suggest no matter what plan you're under, you ask for care management. With AmeriHealth, I'm not sure that you have your therapist becomes a care manager. Basically, they do both functions. So, because AmeriHealth, one of the differences in like a standard plan is they only provide outpatient therapy, psychiatric services, and some substance use disorder treatment. They don't really do those intensive in-home type services that I was talking about, but they also understand crisis, and crisis services are available with them as well. But with Healthy Blue Care Together, there's some value added services, so you can ask your care manager about it. but honestly, you're your best advocate. And in here, that last link that you see there is the member manual. And the member manual, and you can see the instructions there. Type in page 43 if you go down. It's actually on 24 if you printed it out, but electronically it's going to come up as page 43. And that's where there's value added stuff. It just is amazing. So when you go to that website, click on health and wellness. When you scroll down, you'll see several different categories. Health and wellness is where the value added services are, and healthy rewards. Healthy rewards actually gives some pay back to achieving on well care visits, for example. And there is also the Healthy Blue Care Together did go ahead and adopt an enhanced well care visit schedule for children in foster care. It was suggested by the Pediatric Society. They adopted it, and it does create, like, for infants to one, I think it's monthly visits. So it's more intensive, but it's because foster children tend to have more physical health issues along with their behavioral health issues. So this is a way to really intensively support them when they're young, to keep them well and to keep them as well as they can be. So, but all of that is in the member manual. I strongly suggest go in there and click on some of that stuff and take a look. They've got some really neat things that they're doing. They're like, depending on your kid's diagnosis and their issues, you could be eligible for getting a voucher or a gift card to do a summer camp. There's some other kinds of things like gym memberships. So there's a lot of benefits of going in and looking at that, and they do try to create member-specific matches to what you're eligible for. So I strongly suggest that. All right. Wow. Questions, comments? This has been great. You guys have been, I thank you for the feedback, and certainly feel free to reach out with specific questions. I know we've been talking generalities, but if you're having trouble navigating something and you really need some advice, happy to do that. Reach out. Email is the easiest way to get us. And if it's info, you can go through info. You can email Erica or I. We have the same kind of thing. It's kate.peterson@ffa-nc.org. But feel free, and we really do want to help this new plan work for everybody. And we are committed to being honest about what's right and what's not. So appreciate your feedback.
Thanks, Kate. I'm going to stop recording at this point in case anybody wants to stay on and ask an additional question. So I'm going to stop that.